Friends, having understood the basics of first trimester screening in the first part of video, let us now consider post-test scenario. If your NT is more than 3 mm or your fetus doesn't have visible nasal bone, or it is low, hypoplastic or small, or there is presence of cystic hygroma, that means extensive fluid collection behind the nape of the neck, extending to the lower back also, there are high chances of chromosomal abnormality and or structural abnormality. Therefore, you will be offered a definitive diagnostic invasive test, which is chorion villus sampling before 14 weeks of pregnancy or amniocentesis after 16 weeks of pregnancy. If your fetus has NT less than 3 mm, we advise an add double marker test, so it becomes a combined test. So the software gives again the result of combined test in the statistical manner. If it shows low risk, that is 1 in 1000, the aneuploid is highly unlikely. Therefore, we reassure the patient that things are all fine. If the result is high risk, that is 1 in 250, that is the indication for you to undergo specific diagnostic invasive test to rule out chromosomal abnormality. Therefore, we recommend CVS or amniocentesis. If the risk is an intermediate group, that is 1 in 251 to 1 in 1000, here is the consideration of NIPS comes in picture, that is non-invasive prenatal screening or testing. Friends, remember, NIPS also is a screening test. It is much costlier, but it avoids unnecessary invasive tests in quite a few number of cases. What is the result? The result may be low risk, which is reassuring. You may not go for any further testing. If the result is high risk, then again one has to undergo diagnostic invasive tests in the form of CVS or amniocentesis, because there is a very low but definite possibility of a false positive test. After invasive test, the patient may have spotting or bleeding PV for short duration, and the procedure specific risk of miscarriage is 1 in 300. What is the detection rate of NIPS? For trisomy 21, it is as high as 99%. For trisomy 18, it is 93 to 98%. And for trisomy 13, it is 99%. All these has a false positive rate of 0.04%. What about the post-test counseling for preeclampsia? If the results are low risk, we reassure the patient and just offer them routine prenatal care. If the result shows high risk, then I offer my patient tablet aspirin 150 mg per day from the day of the screening test availability till 36 weeks of pregnancy. The same applies for fetal growth restriction. Now, if there is high risk of preterm birth, if there is previous history of preterm birth or history suggestive of incompetent cervix in the past pregnancy, or if the cervical length is less than 25 mm, or the subsequent scan shows shortening of the cervix, then what are the options we have? There are two options. One is cervical circlage, that is tightening of os operation, and the second is vaginal administration of 400 mg progesterone daily till the patient completes 36 weeks of pregnancy. One can consider either of these two options. Friends, as far as structural anomalies are concerned, 10 out of 100 anomalies are detectable at 11 to 14 weeks of pregnancy. I will give you two examples. One is anencephaly, where the forebrain is absent, and second is acrania, where the fetal skull is absent. So, the counseling becomes easier because these two are uniformly lethal. The fetus cannot survive after birth, and therefore the decision making may be easier for the couple. But for other anomalies, we have to counsel the patient that these may be associated with chromosomal abnormalities in the fetus, and therefore we have to offer them a invasive test. We discuss about the prognosis of this condition, quality of life, level of disability, need for surgery, and the possible outcome. And we help the patient in a non-directive manner and help them in the decision-making process. Let us know about the cost of various screening tests and cost of invasive tests. I will talk about cost today in Navi Mumbai, India. NT scan will cost something like 2500 Indian rupees. Double marker test will cost 2500 rupees. Double marker plus PLGF, placental growth factor, will cost 3500 rupees, and NIPS basic variety will cost 13,000 rupees. As far as invasive test is concerned, CVS will cost 25,000 rupees and amniocentesis also will cost something like 25,000 rupees in India, Navi Mumbai. Follow-up after the diagnostic test confirms aneuploidy. We discuss about the prognosis and help the couple in proper informed decision-making process. If the NT value is increased, but the invasive test shows the karyotype is normal, now what? Friends, remember, incidence of structural defect in this group is higher. So even though the chromosomes are normal, we have to look for the structural abnormalities. Repeat scan at 15 weeks and again anomaly scan as 18 to 22 weeks. And also, because the cardiac defect incidence is higher, this pregnant woman is subjected to fetal 2D echocardiography at 22 to 24 weeks of gestation. Friends, there are so many frequently asked questions after the first trimester screening which come up in our day-to-day practice. I'll give you several examples. Question number 1. Sir, NT is more than 3 millimeter. You tell me that increased rate of chromosomal abnormality, structural defect, cardiac defect is there. Then why not to proceed for termination of pregnancy directly? I explained to my patients that in certain percentage of cases, NT may resolve after 14 weeks and there may be absolutely normal outcome of pregnancy. Therefore, remember, NT scan is a screening test and from NT scan alone, taking decision of termination of pregnancy is not correct. One has to undergo diagnostic tests in the form of CVS or amniocentesis, which is important for karyotyping. That helps the patients in decision making and also helps in defining the recurrence risk. What will happen in the future pregnancy? How common is the recurrence or not common the recurrence? Question number 2. NT is more than 3 millimeter and you find a major structural anomaly. Now what? Can we do termination of pregnancy directly? I'll tell the patients that NT is a diagnostic test again, and it's better to find out the etiology of raised NT and calculate the recurrence risk of that particular condition, and therefore invasive test is recommended in these cases. The third is the most common scenario. The couple comes with the report, sir, the first trimester screening report is low risk. So now everything is fine. No problem, no need to take any anxiety or tension. I tell the patients, congratulations. First trimester screening is shown low risk, so which is very reassuring. The chances of false positive and false negative are very few. Friends, but as far as the structural anomalies are concerned, at this stage, CRL is just 6 to 8 centimeters, and therefore only 10 out of 100 anomalies can be detected at this particular stage. Therefore, we proceed with the normal routine antenatal care, and anomaly scan as indicated at 18 to 22 weeks is the next step. Do not forget about the evolving anomalies which can be detected even after the anomaly scan, that is in the third trimester or sometimes even at the time of birth. Question number 4. What is the recurrence risk of aneuploidy or a structural abnormality? Friends, it depends on the nature of the aneuploidy detected and or the structural abnormality detected, and your healthcare provider is the best person to guide you on the individual specific basis. Friends, here I like to talk a few things about the future of first trimester screening. First, will NIPS replace anti-scan, that is 11 to 14 week scan? No, NIPS can predict only chromosomal defect or aneuploidy risk, whereas anti-scan can do four more things as I already talked in the earlier part of the video. Question number 2. Will NIPS replace double marker test? Yes, it will be, because it has very high detection rate or sensitivity for aneuploidies. When? Friends, maybe as soon as the cost comes down, the NIPS is likely to replace double marker test. And the future of first trimester screening will be supplementary testing, that is anti-scan plus NIPS. So friends, remember three things. For first trimester screening, proper pre-test and post-test counseling is important, and one has to follow a set protocol as per the results. Number 2, first trimester screening today is NT plus double marker test. And number 3, first trimester screening tomorrow will be NT plus NIPS. So friends, keep watching, update your knowledge, put your comments and queries in the suggestion box or comment box. Friends, this video is also available in Hindi language on my Hindi channel. Subscribe for more information. Thank you for watching this video. Thank you.